Hi, I'm Janet Reed. I'm the nursing supervisor for the New Canaan Public Schools, and I want to go over our preparations for back to school. I just want to remind you that the safety of our students and our staff is our highest priority and guides all of our decisions. Just welcome back. Let's go through these basic protective measures that we have in place to keep us all safe during this pandemic. These are unprecedented times, and we need to work together. So, what are the facts that we know about COVID-19? We've heard so much over the past few months. But remember, until we have a vaccine and a treatment, prevention is our best protection. This is a novel coronavirus, which means that we are all at risk. The virus is primarily spread by droplet transmission when someone with the virus coughs, sneezes, laughs, talks, or sings. These droplets enter through our mouth, nose, and eyes. There is also some transmission from the virus on surfaces. The greatest risk of transmission of COVID-19 is person to person within 6 feet for more than 15 minutes without ventilation. That is the definition of close contact. So our plan is based on these scientific facts that we know about COVID-19. So the symptoms, originally we were told it was a respiratory illness with fever, shortness of breath, and cough. Now we find many people do not have a fever, and the symptoms have expanded to loss of smell or taste, gastrointestinal symptoms, sore throat, congestion, headache, muscle aches, and fatigue. And of course, the problem is these symptoms mimic other illnesses, not COVID. But since this is a pandemic, we're going to be very cautious with people who have symptoms. So for everyone's protection, there are several pillars to our plan. Number 1, stay home if you are sick. Self-monitor for symptoms and possible exposure daily and follow the guidance in our state exclusion plan. Maintain the 6 feet of distance whenever possible. We know that most of the droplets fall within 3 feet, so the 6 feet gives us that spatial protection. Wash your hands frequently and correctly. Hand washing is the single biggest thing we can do to protect ourselves. Wear a mask or a face covering properly. This is not a suggestion, this is a requirement. Don't touch your face since we know germs enter through our mouth, nose, and eyes. Cover your coughs and sneezes with a tissue. Avoid large gatherings and minimize the number of people that you have close contact with, cohorting as much as possible. And we have a clear system for managing staff and students who become sick during the school day to isolate them and prevent the spread. Our cleaning and ventilation systems district-wide are increased, and we are utilizing outdoor spaces when possible. Hand washing. Frequent hand washing, again, is the best way to avoid infection. It also protects us from COVID-19, flus, colds, stomach bugs, staph infections, strep, and so on. So wash your hands thoroughly and frequently. There's a demonstration here of hand washing from the World Health Organization. And here are the summary of steps. And friction is very important when you're washing your hands. And maintaining that 6 feet of distance throughout the day whenever possible. That is providing us our spatial protection. And wearing a cloth mask or face covering. Everyone is required to do this. The masks must cover the nose and mouth, and it's important for us as adults to be models for students. Below are specific instructions on wearing and caring for the mask.
First of all, before I would put on one of these masks, and this, so that you can see, is a cloth mask that was graciously given to us, made by one of our listeners. Before you put on a cloth mask, you want to make sure that you wash your hands, either with soap and water for 20 seconds, or you can use some sort of hand sanitizer, which I'm just going to pretend so as not to use that. And you completely rub your hands until they're dry when you use it. Now you would pick up your cloth mask by the ear loops. You don't want to touch your mask as much as you don't have to. And you're going to put it on your face. And this is your moment to adjust. If you have a tab here to tighten it over the nose, this one doesn't, but if you do, tighten it over your nose and make sure that it is pulled down underneath your chin and that it's completely covering your face as much as possible, accepting that these are going to have gaps, unlike medical grade masks. Once it is on your face, you want to do your best not to touch your mask at all. That's part of the benefit of one of these masks, is that when you're wearing it, it's a reminder not to touch your face. It's also why I wear my hair pulled back a lot more now, is it's one more reason that I might accidentally touch my face. So you wear your mask when you're out doing whatever your essential business is. When it comes time to remove your mask, 2 scenarios. Let's say one, it's the end of the day, you're going home, you're going to remove your mask for good for the day. The best thing to do is you get home, you wash your hands again, or use hand sanitizer, and then remove your mask, only touching the ear loops, and throw it directly into the washing machine. That's one option if you're done with your mask for the day, and then you want to use a regular wash and dry cycle with your mask. If you need to take your mask off and you intend to put it back on again soon thereafter, so let's say you have to eat lunch, what you want to do is, again, remove your mask by the ear loops after you've washed your hands. Place it on a paper towel that you've labeled with your name, just in case maybe other people are also using masks, with the outside down. It's very important that you keep the outside against the paper towel and not on any surfaces that it could contaminate, and not somewhere like this where you may be forced to touch it with your hands when you go to put it back on, because then you've contaminated your hands. So this is the other option. And then once you have to put it back on again, only by the ear loops, and replace it as you had it before. That is the important thing to remember with these cloth masks, is that, one, they do not completely protect you from either spreading the virus or getting the virus. So while they are an added layer of protection, they in no way replace social distancing and hand washing. And 2, once you've worn them out in the world, you have to consider that outside contaminated, and you need to treat it like something that's been contaminated and make sure that it is washed and cared for appropriately so that you don't undo all the good you're doing by wearing the mask in the first place. If you want more information on how to wear these masks, make these masks at home, CDC.gov has a wonderful section on the use of cloth masks, what they can and can't do, what their limitations are, what their pluses are, and how you can create one of these to use on your own. In the meantime, wash your hands, stay safe. Thank you.
So for most staff and students, a cloth mask is all that will be required. Remember, they protect others from the germs that you may exhale, and other people's masks protect you. But you're also protecting yourself wearing a mask, and it takes teamwork. For those of us who must have close contact with a student due to their needs, a surgical mask and a face shield are indicated. The N95 masks are reserved for healthcare personnel involved in procedures. Again, stay home if you are sick. All staff are expected to self-monitor for signs of illness before coming to school. Parents are expected to monitor their students for signs of illness before sending them. And we are asking everyone to complete the daily self-checklist before coming to school. If you think you have COVID, call your doctor before visiting there. They have certain procedures for managing that. So surgical mask and face shields, remember, we're all going to be wearing them. So have yours labeled with your name, wash your hands, put the surgical mask on, and put the face shield by holding the upper corners, centering the foam on your forehead, and then pull the elastic over your head. For gloves, we always wash our hands before we put gloves on, inspect for tears, pull them on over your sleeves if you have long sleeves on. For removing gloves, which can be more challenging, that's called doffing gloves. You want to wash your hands and be very, very careful not to touch the outside of the glove, which is contaminated.
Sam is entering her patient's room to perform a skin assessment. As part of standard precautions, Sam puts on gloves. Oops. Let's try that again, Sam. Sam performs hand hygiene and then puts on her gloves. Sam knows the outside of her gloves are contaminated. Using her gloved hand, she grasps the palm area of her other gloved hand and peels off the first glove, holding the removed glove in the gloved hand. She slides her fingers of her ungloved hand under the remaining glove at her wrist and peels off the second glove over the first glove. She discards the gloves in a waste container. Sam performs hand hygiene. That's more like it, Sam.
So we always want to be sure to clean high-touch surfaces. We want to avoid sharing materials whenever possible, being very protective of your phone, your workspace, using sanitizing wipes or approved cleaners for doorknobs or those high-touch areas in your personal workspace. Our custodians have increased cleaning to meet these guidelines, and once again, don't forget to wash your hands. Stay safe. Be well. Remember, our 3 biggest keys to safety are hand washing, our personal protective equipment, maintaining social distance. And if you have any questions, you can reach out to me, or in your buildings, your school nurses will be an invaluable resource as we move through this together. Thank you very much.